Okay, we go ahead and get started. Maybe, perhaps. Technology is such a wonderful thing.
Before we get started, let me read the emergency evacuation procedures. In the event of an emergency evacuation, an alarm will sound. Everyone should exit the building by way of the nearest stairwell in a safe and effective manner. If the nearest stairwell is blocked by smoke, use the other stairwell. Do not use the elevator. Once you've reached the main floor, follow the exit signs to exit the building and quickly proceed away from the building. Please be mindful of others evacuating and of emergency vehicles.
Okay, if you have not registered your presence, go ahead and do so, even though okay, we do have a quorum. Chair would entertain a motion to set the agenda. Commissioner Stinnett. Commissioner Carver seconds. Carver. In a second, you will be able to vote.
Should do it.
Okay, let's slow it up.
I'll put it in manually. They'll just tell me.
Is there any objection to setting the agenda? Hearing no objection, the agenda is set. Just put it in. Okay. Next item is input on items on the agenda. Anybody got any comments? See no hands. Next item is discussion, possible action regarding delivery and reimbursement of pharmaceuticals to local pharmacies. The intent of this meeting is to allow our local pharmacists to inform us of the problems that they're having with getting reimbursed for their pharmaceuticals. And we were supposed to have someone else here. Apparently they had an emergency or something and they're not here. So we're going to go ahead and listen to our pharmacist. Who wants to be first? I think if you want to sit right over there, I will turn that microphone over there. Identify yourself. That microphone should be on now.
Is that good?
There you go.
Okay.
Just identify yourself and where you're from. And
Okay. I'm Phil LaFoy. I'm a pharmacist. I'm one of the owners with Blount Discount Pharmacy here in Maryville and Alcoa. This is Aaron Clark. He's my business partner. Aaron works at the Gill Street store in Alcoa. I primarily work at the Montgomery Lane store in Maryville. But between the two of us, we own the 4 locations. I appreciate the opportunity to be able to address you today. We started this conversation back in December with the mayor, and we've reached a situation of great concern. In mid-October, we saw our reimbursements for medication that we dispensed to the county employees drop significantly. Not that we were making much money prior to that, but our nose was above water. And that's kind of an eye chart that we have on the screen there. But I have a few copies of that if some of you would like to see it in paper so you could look at it. I don't have enough for all of you. But basically what that shows That shows the trend of the Blount County employee insurance plan from July of 17 to current. And just to give you an idea, the most recent numbers I've seen, and the folks in Human Resources probably have a more sound number than I do, but from a county standpoint, our pharmacies dispense about a fourth of the prescriptions that are filled in Blount County overall. And I would have to assume that we're close to that from a market share standpoint with Blount County employees. This particular plan, if you look in July of 2017, between our 3 retail stores, we filled just over 1,000 prescriptions with a profit margin of about 3.75%. $3.75 per prescription was the profit margin on those prescriptions. In August, that number dropped to 37 cents per prescription. And let me classify that. When I say profit, that's the price against the cost of the drug. That's before I pay anyone. That's before I pay the light bill. That's purely against the cost of the drug. So in August, on average, we received 37 cents a prescription. And as you can see, it trended downward until end of October, 1st of November, when we dropped to a negative 4.9% margin, which meant we lost $2.50 per prescription. It cost us about $13 per prescription to fill one, when you consider the labor and the overhead. So we've seen that trend downward. I ran the numbers from January 1st through today. We're sitting at a 0.7% gross margin on the county employee drug plan. That averages 34 cents a prescription gross profit since the first of the year. Excuse me.
Mr. LaFoy, if you could tell us when you want to move when you want to go to the next.
Well, I've only got the one slide. That's
Oh,
just,
you only got the one?
like
Okay,
I said,
sir.
that's kind of an eye chart there.
Okay, thank you, sir.
Which column are we wanting to look at?
What do you want to look at, Commissioner Stewart? There you go. I think we got handouts here. While we're doing that, I do want to welcome Representative Moon and Representative Ramsey. Thank you, folks, for being here. Thank you.
Forgive me, I'm not a wizard on Excel. This is about as good as I get. So just the chart in the top left, column B under profit, that's gross profit against the prescriptions we filled for that particular month. You can see the gross margin percent, prescriptions we filled. So we average 1,000 to 1,100 prescriptions a month for Blount County employees and their families. And then you can carry on, you can see the profit per. The 3 charts, just to give you an idea, if you look at the lower right chart where it says ACQ per RX, so that's what we pay for medication. So you see that's been up and down since July, but if you drew a line through there, the one to the right over there with the blue line. So the price of medication has stayed pretty consistent over this period. So that obviously hasn't affected reimbursement. The top right with the blue line, that just shows, that's plotted the profit per prescription for each month. And you can see where that's trended. And it's a little misleading. You see we've got an uptick there at the end, which is a good thing. But that uptick We're showing, as of the end of April, we're making $1.04 per prescription. And then the one that kind of tells it all, the other chart that has the total sales and the acquisition costs, as you can see, one line lays right on top of another. That means I'm being paid what I paid for the medicine and nothing else. So all that said, we have made every effort to take care of these folks and their families. That's our job. We provide health care for the community. Give you an idea of some of the things we did. I've got a prescription for a drug here that cost me $113.76. My reimbursement was $8.75. We filled that and dispensed it. Our prescription cost me $449.56. We were paid $275. I've got something real close. Here's one. We paid $161.77. Our reimbursement was $17.98. And it goes on and on and on. And these numbers are reflected in what you see there. Bottom line is, we're here to take care of the people of the county. But I dare say if the county was in a situation and facing these kind of numbers, there would be an outcry, there would be an uproar, and somebody would have to do something or you couldn't exist. This is one plan of many, but this is a big plan for us. So it's almost as if we're subsidizing, in addition to the taxes we pay and the money we pump into this county day in and day out, here we are now asked to subsidize a benefit for the county employees. That doesn't seem quite right. And I'm confident unless we make you aware of these things, you have no idea. I hope you have no idea. We've seen CVS Caremark, as of late October, their reimbursement nationally plummeted. I have access to quite a bit of data, and the data I have covers 4,000 or 5,000 stores nationally, and the plan for Blount County employees, one of the lowest reimbursed plans in the country. You know, to that I say, how dare CVS Caremark take such cutthroat tactics? How dare them? We can't touch them. They can touch us, I assure you. But I would like to challenge you, number one, as a local businessman. But secondly, as a concerned citizen with a special set of knowledge, I challenge you to do something about this. This can't go on. Obviously, this is not sustainable. I have 85 employees. I got to pay them with something. At 34 cents a prescription, I can't pay anybody. So I need your help. I know there are other alternatives. I know CVS Caremark can pay better. I got other CVS Caremark plans that pay better. So for some reason, y'all been carved out, and we've been taking the brunt of it, and that's not right. So either you need to challenge CVS to come to the table, or I encourage you to shop this business. I know there's plans out there that operate in a different way that companies like CVS do. I know they will take care of you, and they will take care of us. Anything?
Thank you, sir.
Questions? Anybody? I'm here and open.
Mr. Graves, you're recognized, sir.
Mr. Chairman, may I ask a question of the speaker?
Yes, sir. State your question.
All right. Out of the examples that you gave, Mr. LaFoy, there are 1,000 to 1,100 prescription count, and you gave 5 or 6 examples. Is that skewing your numbers, or are you that upside down on every prescription? Or are those few prescriptions, what's putting you upside down? Thank you, Mr. Chair.
And Mr. LaFoy, can you answer that, please?
You got a little bit of both there. Those examples I gave are a part of the numbers that I presented here. So it's all over the place. There are some prescriptions where we are profitable on, but there are some we're not, and some we're obviously in a major way we're not. Unfortunately, we found ourselves, it was kind of strange. A lot of the prescriptions for topical applications like creams and ointments, they were some of the very worst. And we found ourselves asking folks to get them somewhere else because the reimbursement was so bad on them, and we didn't feel like after we pushed back, I reached out to all of y'all, we pushed back on CVS and we were getting nowhere. So we were having to ask people to go somewhere else to get their medicine filled, which is, in my opinion, morally wrong for where I sit. But I got to pay the bills too. Did that answer your question?
Did that answer your question, sir?
Personally, I would like to see some numbers of, out of those 1,100 prescriptions, was it 20 of them? Was it 10 of them? Was it, the profit margins
I see what you're
anywhere
saying.
from 0 to whatever, but it sounded like from the examples you were giving that there could be maybe 20 of them that are putting you upside down. So
Gotcha.
it would be good to know maybe an approximate number of those 1,100 that are squeezing your profit terribly, as you had said. One that costs $200 and you're only getting $5 for it. There should be some kind of an estimated number of prescriptions that are like that.
Okay. So, 640 prescriptions out of, this is November. I'm looking at a different chart, so I don't have the bottom line number on it. Around 1,300 prescriptions in November, 640 of those were below cost. I can break it down by month if I need to.
So 640 of the 1,100 were
We're below cost.
cost?
Yes, sir.
Okay.
Thank you, Mr. Chair. That's what I was
Does that help?
asking. Yes, sir.
And I will say, and it varied. Like I said, that was 2-3 cents up to $200 and $300. Yep.
Mayor Mitchell, you're recognized, sir.
Yes, I probably have a question for Phil, and then I may need to ask Carrie. Who determines what you're reimbursed for a prescription?
The PBM, in this case, CVS Caremark.
Okay. And what do they base that reimbursement on? I mean, is that something Carrie can answer? Is that, what do they base, if you're given a certain amount for a prescription, and why are they, and they're going to say, well, we're going to reimburse you at this. What's that based on?
On the brand drug, it's based on a discount based on the average wholesale price plus a dispensing fee. And that's not where the problem lies. The problem lies in generics. This is an age-old problem, but it's just gotten a lot worse in the last few years. The price of generics are based on what we consider ambiguous information. Most of these companies, like CVS, they own mail order facilities. They buy medication much, much cheaper than we're able to buy. They receive rebate dollars from drug manufacturers to support that. So the prices that they reimburse, we never see. We have no way to purchase at the level that they reimburse because we can't purchase like they purchase. But, so we have no basis. The contracts are ambiguous. But unfortunately, it's either you sign the contract or you don't get the business. And you sign it with a certain level of hope and trust that the PBM will do the right thing and at least pay you for the services rendered to the patient. In this particular case, that's not taking place.
So CVS, and I'm assuming Walgreens is in there since they're as big as probably a CVS, they're able to buy these drugs cheap, at a better rate than you can because of the quantities that they're buying across the country. And then the CVS or whoever's reimbursing is basically reimbursing them and you based on what they think the discounted prices they're getting for.
I don't know what their basis is. I'm speculating when I say that on the generics. We don't know, and I don't know. I would have to assume Walgreens would have a different contract than what we have. Because one of the things, we have a law in the state that says when we get in a situation like this, we're underpaid, they're supposed to be able to share with us where they got their pricing and so that we could actually go out and buy it. But that hasn't worked so well since that law was passed. We haven't gotten very far with that.
And can I continue here? Yes, sir. I'm just trying to get a better understanding. So, Phil, is there a market that advertises the prices, or how do you get determined what you're going to pay, and how does CVS get determined what they're going to pay? And I mean, is it like a stock market and people are?
No.
How does it work exactly?
No, sir. I mean, I buy from a wholesaler. And I would have to assume CVS, because of their volume, they probably buy a great deal of their medication direct from the manufacturer.
Okay.
And that in and of itself could drive a lot of dollars.
Well, you're losing one whole step in the process.
Yes, sir.
Okay. All right.
The intent of this was to have a discussion, so if you want to address any of these things, feel free to do so. Okay. Commissioner Stinnett, you recognize, sir.
Chairman, I'd like for you to ask the question to the speaker. The lawsuit that 7 states have that are adjacent, to Tennessee. What is the basis of that lawsuit? Why is there a class action suit that's dealing with what part of this?
I don't know if he's aware of that, but Phil, do you know anything about that? Can you shed any light on that?
I'm not clear which lawsuit you're referring to, Tom. I'm sorry.
Under the understanding that there's a lawsuit by Arkansas and some other states that's directed towards Caremark in relationship to what we're talking about.
Right.
What is the basis
So
of
the
that
basis
lawsuit?
is pricing. It's reimbursement. It's predatory pricing. Most of the states, Arkansas it's gotten so bad that Arkansas, in addition to being a part of the class action lawsuit, called a special session just to address PBM issues, of which CVS Caremark is one of the PBMs. There were those 7 states, and I'm pretty sure others, who passed legislation this year trying to, for lack of a better term, hold the PBM's feet to the fire, so they're more transparent, so that we can know what the basis of their reimbursements are, to see the money trail. You don't get to be a $1 billion business by not doing a lot of things. And So we've, actually in the state of Tennessee, there was so much attention given to Arkansas, we were able to get our bill passed with very little fanfare. So we now have a bill passed that will require a PBM to be licensed in the state to do business with us, and if they're bad players, they will be at risk of losing their license and unable to do business in the state. And we do have that legislation passed, thanks to.
I would ask you, you do prescriptions for people on the state plan?
Yes, sir.
Are you having the same issues with the state plan?
No, sir. I don't have that number in front of me. All I brought was Blount County, but no, sir, it's not anything like this.
So it's specific to this plan here?
When this happened, and I've been called out on this, but I'm going to say it because I believe it to be true. On October 26th of 2017, CVS announced their intent to purchase or become a partner with Aetna. Reimbursements plummeted. Their phones went out of service. The portal we have to appeal price discrepancies was shut down. We lost all contact with CVS. That was a heck of a coincidence. And slowly but surely, so through the various channels we have, we pushed the national level, and we've slowly seen reimbursement move, but obviously not anywhere near where we were in July. And something's wrong with that picture. Something's wrong. There was one of the things that brought, your plan is a big one as far as how low it is. CVS services a lot of Medicaid plans nationally, and that was where the greatest outcry was, is those reimbursements plummeted as well, and they got a lot of attention. Me and Aaron, we don't get a lot of attention, except at home maybe. So, the attention we tried to raise on this didn't get very far. But it was a national thing, but it was segmented.
Thank you.
Yes, sir.
Ms. Crisp, you recognize, ma'am.
How many Blount County employees use your pharmacy? Do you have any idea?
I don't. You'd figure, help me, Aaron. I mean, if you're filling 1,100 prescriptions a month, I mean, if you figured 2 per person, I mean, there's at least 500 patients a month that we're seeing. Family, and that includes family members. So we see a lot of folks.
Commissioner Stenich, you recognize, sir.
Chairman, thank you. Have you seen any effect or any relief because of the new law? It's not had a chance to do anything.
It's not in play yet.
Right.
It's been passed and signed.
And besides that, what can us locally, just local government, what can we do to help you?
I think if I had the ability to do anything, I would put an RFP. I would seek other plans. I would seek different types of plans. There are plans. When the PBM was established, it was not established to become a billion-dollar industry. The PBM was established to process claims. It used to be a flat rate per claim, and somebody a whole lot smarter than me figured out a way to make some money at it, and they've done very well. So, sorry I was ill prepared when I came here. I'll lose my train of thought. But if I could change it, I would seek a plan that was a very basic plan, somebody that can process claims for you. They can do it to a certain extent. They can manage your formulary. They can create a formulary, manage your formulary. but not run everybody in the ground like this is going. I mean, I don't know your numbers. I wish we could compare. And that might be something that we could sit with the CBIZ folks and sit down at the table. I'd like to see what you're being charged on these prescriptions that are $100 below my cost. That'd be an interesting exercise to see what that's costing y'all and to see how much money's being pocketed by the middleman. Because I can assure you it's a lot. So I think that's got to change. You got to find a plan that's going to be transparent in how they operate. They operate on a per claim basis. They do some basic management for you. And I can assure you the CVS folks will tell you that will never work, that they're going to save you millions of dollars. That's what they do. That's their business. But I know there's plans. You can talk to the folks at Blount Memorial Hospital. They've changed to one of these plans, and they've seen significant savings on their drug spend. It's there, and they're out there, but you have to make the change, and you got to ask the question. I'll be glad to give you information and give you names.
Okay. Mr. Rich, recognize, sir.
Thank you, Mr. Chairman. Does anyone, or has anyone else brought forth issues with their reimbursement?
Yes, sir.
To your knowledge? Other local pharmacies?
There are others. I believe Mr. Stinnett was contacted by other pharmacies.
Okay. Okay, 2 others. I'm just trying to see if this isn't just isolated to Blount Discount. This is more widespread.
That's correct.
And
That's correct.
Mr. Chairman, if I understand this right, is that the issue is with the plan and their control over what is reimbursed to our businesses. Is that correct?
That is my understanding, sir, yes.
Okay. And if I understand this gentleman, is that he is saying a potential solution would be to put out an RFP. Is that, do I understand that?
That is one of the suggestions, yes, sir.
I just wanted to make sure that I've got my collective thought about me related to this. Thank you.
Yes, sir. You're very welcome. Anyone else? Yes.
In terms of looking at other PBMs, do you have any particular ones that you recommend that you feel as though would be a better fit for Blount County
I know
government?
the hospital went with AmeriClear. They're being processed through MPS. That's the company that they've used.
It's also my understanding that moving with one of those more transparent PBMs, that there are some other things that come along with those to generate savings, maybe a little bit stricter formularies and things of that nature. Is that your understanding as well, that there may be some other changes that would come along to the Blount County pharmacy plan?
That I don't know. We don't get formulary. We don't get a list saying this is covered, this is not, on any plan. We find out at the point of sale when we process, we get a paid claim or a rejected claim. I mean, there's got to be savings somewhere, obviously, but I can't address that. I don't know.
And then also the savings or what you're finding as far as your reimbursement with CVS Caremark. I think I understood you to say that you feel as though this is specific to Blount County government's plan, or it's my understanding that, do you have a contract that you negotiate directly with CVS Caremark for your reimbursement rates, or no, this is specifically with their plan?
No, I do not have a contract with the county per se. I have a contract with CVS through a PSAO. You familiar?
I am,
Not to
yes.
insult you, but I just wanted to be sure.
Yes, sir.
Through the LeaderNet PSAO. So that contract is there. So when I submitted an inquiry to LeaderNet, I told them I was really concerned because these numbers were just so incredibly low. And I finally got a guy to run the group number on it. And he called me and he said, "Holy cow, Phil, these are terrible." I'm like, "I've been trying to tell you that for 3 weeks." And he couldn't find another plan that was as low, paid as low as this group. Like Mr. Caskey's point, the state employee plan is a Caremark plan as well, and it's completely different. And contracts look the same because it says MAC plus 50 cents, you know, and then the age-old question is, what is MAC? And we have no access to that, and we have no say in that.
So this is something you've tried to address with CVS Caremark directly and
Yes.
gotten nowhere?
We have addressed personally, we have addressed through the PSAO, there have been corporate meetings between Cardinal Health leadership and Caremark leadership about the entire thing, not just Blount County, because there were great cuts across the country.
Yes, this is a
Just to
national
us,
problem.
this is what we know, because this is the one we're seeing the worst. But they addressed it as a whole, not Blount County in particular.
Okay. That answers my questions.
Thank you. You know, Mr. Graves,
So something you said earlier, I think you said, if you have a certain drug, let's call it Tylenol, are you saying that our plan reimburses you less than it would reimburse another pharmacy such as Walgreens or CVS? So maybe they reimburse you $50 for that drug, but if somebody got that same drug from Walgreens, they would reimburse them more than $50. Is that what I understand?
I don't know. I don't have access to any kind of information like that, so I don't know. There are different contracts. Walgreens would contract with CVS. Blunt Discount through our PSAO would contract. City Drug would contract. There are a lot of contracts out there for the same book of business. They may all be the same for all I know. They could all be different for all I know.
Is that something our consultant can answer, Mr. Chair?
well, there was supposed to be someone here representing that side, but can you answer that question? No. There was supposed to be someone here, and they had to cancel at the last minute. I apologize for that. Yes.
This difference in the amount that you are receiving, if to somehow try to get back to that amount, where would that money come from specifically? Would that the difference in what you're being charged, you're receiving now, like the 37 cents versus the 375, do you see as though CVS Caremark is pocketing more money, not necessarily that money as being a savings to Blount County government's plan? Or I'm just curious to know where that money would come from.
I'm confident CVS is pocketing the money.
So that's where you feel the difference would come from, is directly from the PBM, not Blount County government's
Right.
plan.
I really doubt that CVS is sharing rebate dollars with Blount County government. I mean, I may be wrong there.
Yeah.
But I doubt they are. So I would have to say the money would have to come from CVS.
Okay.
It's not a billion with a B for nothing.
Thank you.
Thank you. Mr. Britt, you recognize, sir?
Thank you, Mr. Chairman. Just another point of clarification. If I understand this correctly, that Blount Discount is getting a one reimbursement related to our plan, but if another employee goes in that's on the state plan, that they get a very different reimbursement from the same company.
Yes, sir.
Okay,
It varies from contract to contract.
okay.
And she could probably address this better than I could when it comes to selling to employers. not to put you on the spot. But you bid it out, and they have to drive the price down as best they can. And if the state stops short and Blount County doesn't, there you are. But it varies. The pricing scheme alone is so flawed. I referred to MAC. MAC pricing is maximum allowable cost, which is just an industry term. But that's the price that we're reimbursed for our generic drugs. And that's the age-old question: where does MAC come from? And we've found that over the years, there's 20, 30, 40 different MAC price lists across the spectrum. You may get price list number 1, the state might get price list number 5. They're running as deep as they can on my end. They run as high as they can on your end. You don't have to do a lot of math to figure out where the difference goes.
Okay. Thank you. Thank you, Mr. Chairman.
Very welcome. Mr. Tennant, you recognize, sir.
Chairman, would it be appropriate for our representatives to ask a question if they have one?
Yes.
Insurance and banking, 2.5 hours, I spent committee meetings, we asked a lot of questions before we passed the PPM license. Representative Francis.
Yeah, I've had bills in the past dealing with the benefits managers for physicians, hospitals, all kinds of insurance programs. This is pretty much a blanket effort across all medical insurance, as well as TennCare. We see the same kind of thing happen. We try to patch together in the state a group of laws that the law that I passed had to do with inspections by PBMs when they would come into the pharmacies, which were done totally inappropriately and unfairly. And we got that straightened out, but we're still working on the transparency, which I think may have something to do with that lawsuit you're talking about. And it comes down, whether it's episodes of care with putting in knees and hips, whether it's bed cost in hospitals, it comes down to the fact, are you going to try to maintain the providers, quality providers in your community? And I think that's probably what we're looking at here. We can kind of turn a blind eye to it, and Phil, tell me, I'm kind of asking a question. We can turn a blind eye to it like we do with TennCare and some of the insurance companies that their idea of controlling medical cost is to take away reimbursements. That's strictly the way that they do it. And what we're allowing is for our quality providers to be minimalized, to be affected, to be run out of business. And so I think this is well worthy of looking at. It's not like you're trying to break the county's piggy bank to support these guys. It's you're trying to get decent, qualified, quality provision for your employees, and that's what the state's done, and they've got a bigger pool to deal with. So having dealt with the Caremark lobbyist in the state, Phil, am I telling an accurate picture of what's happening here?
Yes, sir.
And so that's the reason I feel like it's incumbent on you folks to look at this, maybe try to, when contract time comes back up, try to get the input. I think probably statewide we have 30% of our pharmacists are independent pharmacists, and I think they need to be listened to because they're going to give our employees quality care. And so I would suggest that, and say, in the meantime, Jerome and I will work with the Board of Pharmacy, which we always have, to try to make these laws stronger. But I would encourage you, when contract time comes back up, get the players that you trust, the players that are quality, the players that are taking care of your folks, to have some input into the contract. And we'll try to do our part on the legal side, the law side, but it requires you to have some confidence in these folks. Phil, am I accurate in
Yes, sir.
describing that?
Yes, sir, you are.
The other item is, like I say, the licensing bill that went through was designed to find bad actors. And once they're found, do something about it. But the counties and plans, public sector plans, can act on their own also.
Right.
And help bring pressure. The key is trying to find out, like you say, how much are they charging Blount County for that prescription? That's the key. And once that's known, then the bad actor side can come in and use the law that was passed.
Right.
Thank you, Mr. Chairman.
Thank you very much. Phil, you want to follow up on that?
Yes, sir.
Or
I'm good. Can I offer an unsolicited opinion?
by all means.
So you have to consider, and this gets into the Federal Trade Commission issues. You have a company that owns a PBM, they own a chain of drugstores, they own specialty pharmacies, they own mail order pharmacies. The best place for me to be for them is not here. And it's kind of scary that they own the lives and they determine what I'm paid. That when I sign those contracts, it says MAC, maximum allowable cost. Once again, we don't know which MAC list it's coming off of, but they do. They know exactly what they're doing.
So you don't know where that comes from?
No, sir.
Okay.
We know it when it shows up on the reimbursement screen.
Okay.
Most of the time when you ask about MAC, you're told that's proprietary. There are some plans like the state will publish their MACs for TennCare, but most commercial plans, we're not privy to that. We just
Right.
take it as it comes.
Okay.
We
Mitchell.
need, I'm sorry, go ahead.
Mayor Mitchell, I'm sorry.
Go ahead, Phil, if you were getting ready.
Well, I was just going to say, we don't want to pull out of this plan. We don't want to tell people to go somewhere else. You know, these are people we know we've taken care of for years, and it's entrusted their health care to us, and we need your help.
Mayor Mitchell?
Just sitting here and listening to what's been said, there's no one that wants to see local businesses do the very best they can. And I understand. I hate it. I was just sitting here thinking, God, if Amazon ever gets into the pharmaceuticals, everybody's gone. I mean, that's I know what they've done to a lot of the local and the Walmarts and things like that have just came in and I don't understand how the market changes for you than it does for CVS. I don't know why, other than volume or whatever, gives them the opportunity to buy these pharmaceuticals at a better price than you can. I guess that's how it works. I'm not real sure how that world works. And I'll be honest with you, it would probably scare the hell out of me if I knew how that world worked in the pharmaceutical business, just from what I've read on other things. I do want to remember, but the bottom line is we are a self-funded healthcare. It's either the employees or the county taxpayers that are paying this. And when I first came here, this system was totally screwed up, and we were at the point of almost losing being able to self-sustain our health care. Since 2014, 2015, when we went to the CVS, you know, we've saved almost $500,000 a year. So I mean, it has been good for putting money back into our health care fund that we pay for. I just don't want to lose sight, and I'm not saying this the way this is doing. I don't know whether this is right or wrong. I don't think it doesn't sound like it's got a lot of the right things happening in how the pharmaceutical drugs are being sold and distributed, where the local people and local business people really are just at the bottom of the list, and those that at the top seem to get all the best deals and the possibilities of making the most money on it. But bottom line is, the system is our system. This is the money. This money is taxpayer dollars and employee dollars. So just don't lose sight of what the bottom line is about who. If things change and we spend more, then it's going to come from employees and it's going to come from the taxpayers if we have to supplement this fund in any way. And I'm not saying that it doesn't need to be looked at, and we probably don't. I think it needs to be looked at the state level and the federal level. I think that's where it's kind of become screwy, and how they distribute it and sell the pharmaceuticals to the pharmacies. But I just don't want us to lose sight when we're talking about this fund, and I say this with a passion because it wasn't that many years ago, and I think Jerome will attest, when we were getting ready to go belly up, and we fought very hard to get this fund back to where our employees can afford it and the taxpayers can afford it. So let's don't. I don't want to lose sight of just not maintaining that from this point on. Thank you.
Can I speak to that, Mr. Caskey?
Yes, sir.
Let me be very clear. I'm not proposing any additional funds be spent by the county. The plan I was referring to at the hospital, there was a $40,000 savings in the first year that plan was brought in. So there are ways, I'm confident there are ways to take care of your employees and their families and us as providers without being out any more money. I don't like paying taxes like much as the next guy. We don't want to spend more, we just want to spend better.
I agree. I think it's incumbent upon this committee and incumbent upon the commission to make sure that we're doing the best thing for our employees and the taxpayers. And I also believe that the state plan is also taxpayer funded too. Mr. Graves, you recognize, sir.
Mr. Chairman, my question is, if I purchase a drug from Mr. LaFoy's company and our contract says that we will reimburse $100 for that drug, and the county writes a check for $100, does Mr. LaFoy's company get that entire $100?
I don't. Phil, do you know the answer to that?
I don't think you see that. That's part of the problem with the model. My reimbursement is not seen by your human resources folks who see the charge to you for the drug. There's a firewall there.
Where does that money go?
Yeah, we remember billion with a B. That's where it goes. And a lot of that stopped. A lot of playing the shell game, the spread stopped because we all figured it out. We called them out on it. But I say these people are a lot smarter than we are, and they're always coming up with a new game. And it's sad. We focus more on trying to figure out ways to combat this and stay in than we do taking care of people anymore, and that's wrong.
I would ask that question of our Human Resource Department to find out for the committee. If we reimburse a certain amount for a certain drug, who gets that money?
Okay. Mayor Mitchell.
Going back to what Mr. Graves said, we're missing, we need Cole here, and we need the pharmaceutical representative for that company. Kerry, I'm not to take anything away from you, but there has been some questions that Phil's brought up that I think we need someone here to answer them. I think, does anybody else feel that way, that they'd like? Is there some way that, Mr. Chair, that can we reschedule? I mean, I know people's time's pretty valuable, but I sure would like for Phil to be able to come here and voice this and get some. I'd like to hear some answers from these. I mean, is there a way we can do this? That would be what I would ask.
Thank you, Mayor. Mr. Britt, recognize, sir.
I completely echo what the mayor just said. I don't know how long our meeting's been on the books, but I've had it on my calendar for a while, and I know everybody here has made a sacrifice this afternoon to be here. And I have to just register with you, Mr. Chairman, that I am not happy that we don't have a representative here that can answer our questions about this. I don't think that's right. And it's difficult to be balanced and measured when you don't have answers on the other side. But it seems to me that based on what I've heard today is that we've got to get answers from them, because really part of the problem may exist or lie within our own plan. Am I right in thinking that?
I would tend to agree with that assessment. Yes, sir.
Okay. Thank you, Mr. Chairman.
Thank you. Anyone else? Yes. Yes, ma'am. Please.
A couple of other things. I apologize, I'm not able to answer the questions. I wish I were. Unfortunately, there was a family emergency with the other pharmacist that was on staff with CBIZ. But I just wanted to mention that we did look at AmeriClear when we did an RFP for the county back when we selected CVS Caremark. So that is not a new PBM to us. We certainly looked at them along with a number of other PBMs as well. And then I know we were discussing rebates, which I'm also not privy to all the details of everything. But I do know that under the Humana contract that Blount County had prior to the move to CVS Caremark, their rebates that they were receiving were around $80,000. By moving to CVS Caremark in 1 year, that changed to $750,000 in rebates that were directly to Blount County government. So I know that's a large number that came back to the Blount County government plan. We certainly entertain what we would like to see to be best for Blount County government as well, whether that be AmeriClear, CVS Caremark, another PBM. We completely empathize with you as well. It's certainly not anything we would like to see a local pharmacy lose money or anything like that. But this is a much bigger problem on a national scale, so it's trying to figure out the best things that we can do to combat that when it's a national problem that we're all looking at as a whole, that we're seeing from a number of different areas. But, we're happy to work with them to figure out some type of, common ground that we can come to that's best for everyone.
Thank you.
Mm-hmm.
Anyone else? It's my understanding from listening to the speakers that we should try to schedule another meeting and make sure that we have a representative here to answer these questions. Is that the feelings of the body? I will look at the calendar. Well, yeah, the budget's in June. Why don't, we will check with, well, I have Ms. King check with,
If we try to get, the deadline to get it on the June 12th will be June the 6th. So we'd have to have another meeting anywhere around the 4th or the 5th of June. But this is my deadline, to get it to the 12th agenda. Our voluntary products, yes, sir.
well, don't we have a regular schedule, our regular schedule meeting in July, but we want to do this before then?
Yeah, we need to do it for July 1.
Look at before July, because we're actually, since it's time sensitive for the enrollment for opening.
Open enrollment.
So if we can do another one, we can get that on there too.
Yeah, maybe we could do one in between the agenda meeting and the regular commission. Can we do one in between those?
Not if we need to get it before July 1, no. We have to do it before June the 6th. Because commission will meet June the 17th for July 1.
Yeah, but are we trying to get something before the commission?
The US Able stuff, yes.
Oh, that's, okay, I'm,
So
we're on
if
two
we
different
just do it all
tracks.
together at the same time, like the mayor was saying.
Oh, so you're gonna do it then? Why don't I get with you, and then we'll figure it out. I will get with the HR department, and I will notify all the, we're gonna try to do it fairly quickly, in June,
It'll either be the 4th or the 5th.
June 4th or 5th, and I will look, what's on the calendar. We'll have to look and see what's on the calendar already. We do have, June is obviously budget, so. Mr. Tennant?
Chairman, when's our next scheduled meeting?
Next scheduled meeting is July, but there are some issues. I was just informed that there is a couple of things that has to be done before then.
So we're going to have another meeting anyway.
Yes, sir.
So
So
we need
we're
to
going to have a couple of issues. I think the mayor said there's a couple of things that has to be on there. Mayor, you want to?
So we're going to need to do it in the middle of the day?
Mayor?
Could we do a lunch meeting?
Yes, we could do that.
Okay. Let's do it, let's set it up for lunch. That'd be good.
That sounds good. We will try to do that.
Let me, and Chairman.
Yes, sir.
Okay. We also are looking at, on our, the insurance that the employees have that's not county insurance. It's under Dearborn now. We're looking at changing that and going to another provider that provides some more benefits and is going to be a lot easier for the employees to use. It's not it's not county involved, but it's a decision that this committee will have to make to leave Dearborn and go to US Able, back to US Able for like our cancer policies and things like that.
Mr. Britt, you recognize, sir?
Mr. Chairman, is it possible that we schedule, when you have your called meeting in June, can we combine those two agendas and just have one meeting, and that counts as June and July? In other words, instead of having two separate meetings, can we just combine the two to take up all of these issues?
Yes, we could do that. We could do that. No, but if we could just combine the agenda for July and June.
Okay. So then we don't have to have a July meeting, is what I'm...
That's correct. There were certain issues that has to be done for open enrollment purposes, and we can do those in June, right? We can do all of that, and it'll be a long meeting, but we could do it all one time. I will check the schedule. I just remembered that, as the saying goes, I have a scheduling conflict for June the 4th and 5th. I will let everybody know. I've got to do this. I will, of course, Mr. Stenick could always do the meeting. I will inform, I will let all the members know as soon, I will work with Ms. King, and we will get a schedule, and I will send that out just as soon as possible. Yes, yes. There will have to be a quorum there because you will have to conduct some pretty serious business, so,
And some of that information was from CBS's presentation last time, if they won't follow back.
okay.
USA stuff.
Okay. Yes, we will need that. Anything else? I've kind of got lost here. Yeah, we good now? Okay, next item is input on items not on the agenda. Seeing no hands. Let me just mention that I would ask you to keep Miss Morgan in your thoughts and prayers. You know, with the loss of her mother, just kind of remember her. That's a tough time. I've been there and done that. So, okay, if there's nothing else, we're adjourned. If there's no objection, we're adjourned. Hearing no objection, we're adjourned.